if you're dumping hydrogen peroxide on every wound, we need to talk. Just because it bubbles does not mean it's actually helping. Many of us grew up in a generation where any open wound, you should dump hydrogen peroxide on it to clean it out. And mechanistically, that does make sense. We know that hydrogen peroxide has bacteriostatic, or meaning it would stop bacteria from growing, properties, and it does have hemostatic properties. So there are some really good things about hydrogen peroxide, but there's also some things that really limits its use, specifically the bubbling that everyone loves. That's not actually hydrogen peroxide interacting with bacteria. That's hydrogen peroxide interacting with catalase, which is an enzyme that we all have in our own body, and in any healthy tissue, we have catalase, which causes hydrogen peroxide to go from H2O2 to hydrogen and oxygen. So it just breaks it down literally to air and water. The downside is that our body is so good at breaking down hydrogen peroxide so quickly, it's not sustained in a wound long enough to cause bacteriostatic properties for it to kill off any kind of bacteria. Now, I know that will seem like a hypocrite because you can look in my own exam room and I have hydrogen peroxide here. The reason that we tend to use hydrogen peroxide in dermatology is for wound debridement. Or if you've ever had like a crusty scale on top of a wound that you can't get off, we can use hydrogen peroxide. It will come and interact with the normal cells below that crust, and it will cause that oxygen and water to basically lift the crust off in a way that damages the tissue a lot less than mechanical debridement. Beyond that, we know that hydrogen peroxide has some hemostatic properties, meaning it can stop a wound from bleeding. And in certain situations that can be utilized, but on a whole, the damage, the cytotoxicity that comes from hydrogen peroxide is worse than what you could do good with it. You can't really get good bacteriostasis, and the control of the bleeding is just not as effective as something like pressure. So just stick with regular pressure, cleaning it with water, no hydrogen peroxide. We would only use hydrogen peroxide in really specific situations. If you want to clean out a wound, the best thing is just regular tap water. They've actually studied sterile saline versus regular tap water, and they're pretty much equal. Technically, in a clean wound, you don't need to do anything special to clean it out, but if you had a dirty wound, you were out playing and you scraped your knee in the dirt, then definitely running water over it is all you need to do for cleaning. Yep. So after you clean out a wound with water, the best thing is to keep it moist and covered. So you'll hear us a lot talk about Vaseline and a bandage on top, but essentially that is just creating a moist environment that is allowing the wound to heal without drying out. There was kind of that old myth, that wounds needed to dry out. And actually, that creates a scab that I would use hydrogen peroxide to then lift off, because wounds do better in a moist environment. The bacteriostatic qualities of it, or something that makes it antimicrobial or fighting bacteria, requires a high concentration sustained over a long period of time. Because of the catalase enzyme in our body, you can't have that when you put it on a wound that has viable tissue that's going to break it down. But if you're putting it on a tool, theoretically it could work. When you're getting blood out of a fabric, it does work. The mechanism, I'm not entirely sure how to explain why it works, but it's using it to lift it off the fabric.
Okay.